Your mouth is not just for eating and smiling, it's the gateway to your gut health and your immune system. What happens in your mouth doesn't stay there. The bacteria living on your tongue, teeth, and gums have a direct line to your digestive tract and your bloodstream. If your oral microbiome is out of balance, it sets the stage for gut inflammation, leaky gut, and a weakened immune defense. In other words, if you want to fix your microbiome naturally, you have to start with your mouth. Think of the oral microbiome as the front line of your body's defense system. Every bite of food, every sip of water, and even every breath introduces microbes into your body. Healthy oral bacteria help break down food, regulate pH, and stop harmful pathogens from multiplying. But when oral bacteria become imbalanced from sugar, processed foods, or poor oral care, the wrong species take over. They don't just cause cavities and bleeding gums, they travel down the digestive tract, disrupt the gut microbiome, and trigger systemic inflammation. That's why oral health immunity is not separate from gut health. They are two ends of the same system. Research shows that people with gum disease are more likely to suffer from digestive issues, autoimmune conditions, and even chronic fatigue. Why? Because the oral microbiome shapes the gut microbiome, and the gut microbiome dictates how strong your immune system will be. If you want vibrant energy, healthy digestion, and protection against chronic illness, you must pay attention to this mouth-gut connection. And the good news, there are natural strategies to support your oral microbiome gut health. In the next section, we'll dive into the first key insight, how the oral gut connection works and why it's the hidden foundation for fixing your microbiome naturally. The oral gut connection is one of the most overlooked yet powerful drivers of human health. Your mouth is home to over 700 species of bacteria, and every single time you swallow, you're sending millions of those microbes into your digestive system. Some are friendly, protective strains that help regulate digestion and keep pathogens in check. Others, if allowed to dominate, can trigger gut inflammation, disrupt nutrient absorption, and undermine metabolic balance. This means your oral microbiome digestion relationship is not just a side note in health. It is foundational. When your oral bacteria are in balance, they act as allies. Beneficial species begin breaking down food right at the start of the digestive process. They assist in carbohydrate metabolism, regulate oral pH to prevent harmful bacteria from thriving, and prime the gut microbiome for efficient nutrient breakdown. Saliva, enriched by healthy microbes, carries enzymes and protective compounds that aid in the smooth transition of food from mouth to stomach. This is where the oral gut connection becomes so critical. If your mouth ecology is healthy, your gut receives signals that strengthen microbial diversity and overall resilience. But if the mouth environment is compromised, think of bleeding gums, plaque buildup, or cavities. The wrong bacteria take center stage. Streptococcus mutans, Porphyromonas gingivalis, and other pathogenic microbes thrive in sugar-rich, inflamed mouths. When these mouth bacteria make their way to the gut, they alter the balance of gut flora, leading to an increase in harmful endotoxins. These toxins irritate the gut lining, making it more permeable, which is often called leaky gut. Once the gut wall is compromised, undigested food particles and inflammatory compounds leak into the bloodstream, triggering widespread immune responses and chronic inflammation. It's not just digestion that suffers. Research increasingly shows how mouth bacteria gut health disturbances contribute to systemic disease. People with gum disease have higher rates of insulin resistance, obesity, and cardiovascular problems. The mechanism is clear. Oral pathogens influence metabolic pathways through their interaction with gut microbes. Poor oral hygiene doesn't stay local. It ripples through the gut microbiome and affects the body's energy systems. This is why individuals with gum inflammation often feel fatigued or struggle with weight management despite dieting or fasting. Their gut microbes have been hijacked by signals originating in the mouth. The oral microbiome digestion pathway is also deeply connected with immune health. The gut houses about 70% of the immune system, and it takes constant input from the oral cavity. Harmful mouth bacteria can train the immune system to be hyperreactive, raising the risk of autoimmune conditions. Meanwhile, beneficial oral microbes reinforce tolerance, teaching the immune system to distinguish between friend and foe. This delicate balance depends on what we allow to colonize our mouths. Diet plays a huge role here. A diet high in refined sugars and processed foods feeds harmful oral bacteria, which then seed the gut with inflammatory species. In contrast, fiber-rich whole foods, Polyphenol-rich teas and raw vegetables encourage diversity in both the oral and gut microbiome. Even simple habits such as chewing thoroughly, hydrating with mineral-rich water, and avoiding constant snacking support saliva flow and microbial balance. Saliva is more than moisture. It's an antimicrobial, nutrient-rich fluid that acts as a protective bridge between the mouth and gut. Another factor is chronic stress. Elevated cortisol suppresses saliva production and weakens immune defenses in the oral cavity. A dry mouth allows harmful bacteria to proliferate unchecked. Over time, this imbalance spreads downstream into the gut, worsening digestion and immunity. Oral care strategies, therefore, go beyond brushing and flossing. They must include stress management, quality sleep, and nutrient-dense food to keep microbial communities aligned with health. What becomes clear is that your gut does not operate independently. It is constantly shaped by what happens in your mouth. Ignoring the oral-gut connection is like trying to fix the foundation of a house without noticing the cracks starting in the walls. To truly restore gut balance, you must ensure your oral microbiome is healthy, diverse, and free of chronic inflammation. Every swallow is an opportunity. You're either feeding your gut with beneficial bacteria that promote resilience, or you're seeding it with harmful microbes that sabotage digestion and immunity. Harmful oral bacteria don't just cause cavities or bad breath. They have the power to influence your gut, your immune system, and your risk of chronic disease. Every time you swallow, millions of microbes from your mouth make their way down into your digestive tract. When the balance of oral bacteria tilts toward harmful species, this sets off a chain reaction that disrupts gut function and creates a fertile ground for inflammation. The oral bacteria-gut health relationship is now well established in scientific research, yet many people still overlook it when addressing digestive or systemic issues. The problem often begins with gum disease, when bacteria like Porphyromonas gingivalis or Fusobacterium nucleatum overgrow in the mouth. They inflame the gums and weaken the protective barrier around your teeth. This is the first sign that the oral microbiome is out of balance. Gum inflammation opens the door for bacteria and their toxins to enter the bloodstream and digestive tract in greater numbers. These pathogens don't stay confined to the mouth. They spread, altering the gut microbiome and creating a pro-inflammatory environment. This is where mouth bacteria inflammation becomes a whole body issue, once inside the gut. These harmful species disrupt the delicate community of microbes that handle digestion and nutrient absorption. They outcompete beneficial bacteria, lower microbial diversity, and produce toxic byproducts such as lipopolysaccharides, LPS. LPS are endotoxins that irritate the gut lining, making it more permeable. This phenomenon, often called leaky gut, allows foreign particles to escape into the bloodstream. The immune system sees these particles as invaders and launches a defense response, producing systemic inflammation. The result is not just local gut discomfort, but body-wide issues such as joint pain, brain fog, skin flare-ups, and fatigue. Poor nutrient absorption is another consequence of this disrupted balance. When the gut lining is compromised, even a nutrient-rich diet may not be effectively absorbed. People can suffer from deficiencies in vitamins, minerals, and amino acids despite eating well. This fuels a vicious cycle. Poor nutrient absorption weakens immunity and repair mechanisms, which in turn allows harmful bacteria to dominate further. Oral bacteria gut health is therefore inseparable from nutrient status and energy production. The science shows a strong link between gum disease and systemic conditions like diabetes, heart disease, and autoimmune disorders. For example, bacteria that cause gum disease have been found in the plaques of arteries, showing how oral pathogens travel through the bloodstream and trigger inflammation in distant organs. Similarly, the gum disease gut microbiome connection explains why people with chronic oral infections often experience worsening digestive issues. The gut is constantly exposed to inflammatory signals from the mouth, reshaping its microbial ecosystem in harmful ways. It's not only the physical presence of harmful bacteria that matters, but also the messages they send. Pathogenic oral microbes communicate with gut microbes through chemical signals. These signals can shift the gut toward producing more inflammatory metabolites while decreasing the production of beneficial compounds like short-chain fatty acids, which normally protect the gut lining and regulate immunity. Without enough of these protective metabolites, inflammation escalates and the gut becomes less able to defend itself. Over time, this chronic low-grade inflammation acts like a smoldering fire in the body. It may not cause immediate, obvious symptoms, but it silently damages tissues, accelerates aging, and increases vulnerability to serious disease. Autoimmune conditions such as rheumatoid arthritis and inflammatory bowel disease have been linked to oral microbial imbalance, highlighting the systemic reach of mouth bacteria inflammation. What makes this issue so pressing is that gum disease is widespread and often unnoticed. Early signs like bleeding gums when brushing or chronic bad breath are dismissed as minor inconveniences, but they are red flags of microbial imbalance. Ignoring them allows harmful bacteria to flourish and spread to the gut, creating long-term damage. Addressing oral health, therefore, is not just about protecting your teeth. It is about preventing systemic disease by keeping your gum disease-gut microbiome relationship in balance. Supporting beneficial oral bacteria through natural strategies such as a nutrient-dense diet, stress reduction, and proper oral hygiene helps to break this cycle. By restoring balance at the gateway of digestion, you not only protect your teeth and gums, but also strengthen your gut microbiome, reduce inflammation, and safeguard long-term health. Every swallow carries the legacy of your oral health into your gut, and that legacy will either promote healing or fuel disease. Nearly 70% of your immune system is housed in your gut, and the signals that shape it begin in the mouth. The oral microbiome is not a separate ecosystem. It is the front line of the same immune network that protects your entire body. Every swallow, every bite, and every microbial exchange between the mouth and gut helps program the way your immune cells respond to threats. When oral bacteria are in balance, they reinforce the gut barrier, promote tolerance, and regulate inflammation. But when oral health is compromised, harmful bacteria flood into the digestive tract, weakening defenses and confusing immune responses. This is the oral microbiome immune link that determines whether your body thrives with resilience or collapses into chronic inflammation. The gut lining is more than a passive wall. It is an intelligent barrier embedded with immune cells that must constantly decide what to allow in and what to block. These cells depend on signals from both gut and oral microbes to function properly. Beneficial oral bacteria strengthen this system by producing metabolites and enzymes that support gut integrity. They encourage the production of short-chain fatty acids, compounds that feed gut cells, keep the lining tight, and prevent foreign invaders from leaking into the bloodstream. This is how oral health immune system interactions build a resilient shield against infections and inflammatory triggers. When the oral microbiome is disrupted by gum disease, frequent sugar intake, or chronic stress, pathogenic bacteria like Porphyromonas gingivalis and Fusobacterium dominate. These microbes don't stop at the gum line. They travel to the gut and influence immune programming directly. They increase the production of lipopolysaccharides, inflammatory molecules that damage the gut lining and overstimulate immune cells. This disrupts the delicate balance between defense and tolerance, pushing the immune system into a state of chronic overdrive. The result is body-wide inflammation and an increased risk of autoimmune disease. Gum bleeding, swollen gums, or persistent oral infections may seem like minor inconveniences, but they are early signs that the gut immunity microbiome balance is under threat. A strong oral microbiome helps the immune system know when to fight and when to stand down. It trains immune cells to distinguish between harmful invaders and harmless food particles or commensal bacteria. Without this training, the immune system often becomes confused, attacking not only pathogens but also the body's own tissues. This immune misfiring explains why poor oral health is linked with conditions like rheumatoid arthritis, lupus, and inflammatory bowel disease. Each of these has roots in immune dysregulation that begins with microbial imbalance. The oral health immune system connection is therefore not theoretical. It is visible in the pattern of disease across populations. The oral microbiome also influences gut immunity through saliva. Saliva is enriched with antimicrobial peptides, enzymes, and immune signals that travel directly to the gut. A healthy saliva profile helps neutralize harmful microbes and deliver protective compounds downstream. But if the mouth is inflamed, saliva becomes a carrier of pathogens and inflammatory signals instead. This shift subtly alters gut immunity, weakening frontline defenses and creating openings for infections and inflammation. What is remarkable is how quickly improvements in oral health can ripple into immune resilience. Studies show that restoring balance in the mouth through improved hygiene, and dietary changes and natural antimicrobial support reduces systemic inflammatory markers within weeks. People often notice not just healthier gums, but improved digestion, fewer infections, and more stable energy. This demonstrates how the gut immunity microbiome pathway is directly influenced by the oral environment. The oral microbiome immune link is a reminder that the immune system is not centralized in one organ. It is an interconnected web. When the oral community of microbes is balanced, it delivers beneficial messages to the gut, which in turn trains immune cells to protect efficiently without overreacting. When that balance is lost, immune chaos follows. If 70% of your immunity depends on the gut, then your oral health is the key that unlocks its potential. Every step you take to nurture beneficial oral bacteria is also a step towards strengthening your gut defenses and building long-term resilience against chronic disease. Fixing the microbiome is not only about probiotics or gut supplements. It starts right in your mouth with the daily habits that shape the oral ecosystem. The oral cavity is the entry point to your digestive system, and the strategies you use for oral hygiene determine whether you're cultivating a diverse, protective microbiome or wiping it out and leaving space for harmful bacteria to thrive. The concept of oral care microbiome support means choosing practices that restore balance rather than destroy it. By approaching oral hygiene in a natural, supportive way, you can improve not just your teeth and gums, but your digestion, immune resilience, and long-term health. One of the simplest strategies is using mineral-rich toothpaste. Conventional toothpaste often contain harsh, foaming agents and fluoride levels that may disrupt microbial balance. Mineral toothpaste, on the other hand, are formulated with calcium, magnesium, and hydroxyapatite, which strengthen enamel without harming beneficial bacteria. They provide the building blocks your teeth need to remineralize naturally while maintaining an environment that favors microbial diversity. This subtle shift toward oral microbiome repair also benefits gut health by ensuring that the bacteria traveling from your mouth are more balanced and less inflammatory. Oil pulling is another traditional practice with modern scientific backing. Swishing oil such as coconut or sesame oil around the mouth helps to bind and draw out harmful bacteria while preserving beneficial species. Unlike chemical mouthwashes, oil pulling does not sterilize the oral cavity, but selectively reduces pathogenic overgrowth. Regular oil pulling has been shown to improve gum health, reduce plaque, and freshen breath, all indicators of microbial balance. Because this technique lowers the migration of harmful bacteria into the gut, it indirectly supports natural oral hygiene gut health by limiting inflammatory triggers. Prebiotic mouth rinses are a newer innovation that take oral care one step further. Instead of killing bacteria, they feed beneficial strains with ingredients like xylitol, inulin, or herbal extracts. This encourages the growth of microbes that produce protective compounds and keep harmful species in check. Prebiotic rinses strengthen the oral ecosystem, much like dietary prebiotics strengthen the gut microbiome. By enhancing friendly oral bacteria, you send better microbial signals downstream to the gut, reinforcing the connection between oral care, microbiome practices, and whole body health. Tongue scraping is another powerful yet often overlooked method. The tongue harbors a dense microbial community, and if debris accumulates, harmful bacteria can thrive there and migrate into the digestive tract. A simple tongue scraper removes excess buildup and creates a cleaner surface for beneficial microbes to colonize. This not only reduces bad breath, but also lowers the load of pathogenic bacteria traveling to the gut. Incorporating tongue scraping into your routine supports oral microbiome repair by creating a stable, balanced oral environment from the very first step of digestion. One of the most important changes is avoiding harsh antibacterial mouthwashes. These products often claim to kill 99.9% of germs, but that indiscriminate action is exactly the problem. Just as broad-spectrum antibiotics can wipe out beneficial gut bacteria, chemical mouthwashes eliminate helpful oral microbes and leave room for resistant, harmful strains to dominate. Over time, this weakens both oral and gut microbial resilience. By skipping these harsh products and replacing them with natural oral hygiene gut health strategies, you protect the diversity of your oral microbiome, which translates into stronger digestion and immunity. Diet and lifestyle choices also amplify these oral care strategies. A diet high in whole foods, fiber, and polyphenols feeds beneficial oral and gut bacteria, while limiting sugars and processed foods reduces fuel for harmful strains. Staying hydrated with mineral-rich water maintains saliva flow, which is one of the body's natural defenses for keeping the oral environment balanced. Stress management and quality sleep further support microbial stability, since chronic stress and cortisol imbalance suppress saliva and weaken oral immunity. These natural approaches do more than improve gum health or freshen breath. They directly influence the types of bacteria that are constantly seeding your gut. By cultivating a healthy, balanced oral microbiome, you reduce the migration of harmful species, strengthen gut barrier function, and lower systemic inflammation. This is the deeper power of oral care microbiome practices. They repair the mouth-gut axis from the top down. Every simple daily action, from brushing with mineral toothpaste to oil pulling or tongue scraping, contributes to oral microbiome repair and builds a stronger foundation for digestive health, immune resilience, and disease prevention. The relationship between gut health and oral health is a two-way street. You can brush, floss, and scrape your tongue daily, but if your gut environment remains inflamed and depleted, the mouth will continue to reflect that imbalance. Likewise, you can eat the cleanest diet possible, but if your oral microbiome is dominated by harmful bacteria, they will keep seeding the gut with inflammatory signals. The only way to achieve true balance is to support both systems together by combining natural oral hygiene with foods for microbiome repair, fasting practices, and anti-inflammatory nutrients. You create the conditions for lasting healing. The most powerful foundation is food. What you eat feeds not just your body, but the trillions of microbes that line both the mouth and gut. Prebiotic-rich foods like onions, garlic, leeks, asparagus, green bananas, and Jerusalem artichokes deliver the fiber and resistant starches that beneficial microbes thrive on. These prebiotics encourage diversity in the gut while also influencing the oral microbiome through the compounds they release in saliva. Probiotic foods add another layer of support. Fermented vegetables, sauerkraut, kimchi, kefir, and unsweetened yogurt introduce living bacteria that reinforce microbial resilience. Together, these foods for microbiome repair establish a stronger defense against harmful oral and gut bacteria. Fasting is another strategy that strengthens the oral gut axis. Periods without food allow both the mouth and gut to reset. In the gut, fasting promotes microbial diversity, lowers inflammation, and activates repair processes in the intestinal lining. In the mouth, fasting reduces constant sugar and food residue exposure that feed harmful bacteria. Intermittent fasting, extended fasting, or even time-restricted eating can therefore support both oral hygiene and gut resilience. The fasting-gut microbiome relationship is powerful. By giving your system rest, you allow beneficial microbes to consolidate their territory and crowd out pathogens. Anti-inflammatory nutrients also play a key role. Omega-3 fatty acids from fish, flax, or chia reduce systemic inflammation and support gum tissue healing. Polyphenols found in green tea, berries, and olive oil act as antioxidants that benefit both oral and gut bacteria. Curcumin from turmeric has been shown to lower inflammatory markers and support a healthier microbiome across multiple systems. These compounds directly reduce the oxidative stress that damages gum tissues while simultaneously creating a more stable gut environment. The result is a stronger barrier at both ends of the digestive tract. Hydration is another often overlooked factor. Saliva is the body's natural defense in the mouth, carrying antimicrobial peptides and enzymes that protect against harmful bacteria. Drinking mineral-rich water helps maintain saliva flow and supports both oral and gut health. Minerals like magnesium, zinc, and calcium also serve as cofactors for enzymatic processes that influence microbial balance. When hydration is neglected, the mouth dries out, harmful bacteria flourish, and the cycle of inflammation spreads downstream into the gut. Lifestyle choices further amplify the connection between gut health and oral health practices. Chronic stress elevates cortisol, which suppresses saliva production and weakens gut immunity. Sleep deprivation disrupts circadian rhythms, affecting microbial activity in both ecosystems. By lowering stress through meditation, walking, or deep breathing, and prioritizing quality sleep, you create an environment where beneficial microbes thrive and repair can occur naturally. Even chewing itself is a bridge between oral and gut healing. Proper chewing activates saliva, enhances digestion, and ensures that food is broken down effectively before reaching the gut. Rushed meals and poor chewing create a burden on both the oral microbiome and the digestive tract. Slowing down and chewing thoroughly may seem simple, but it profoundly impacts microbial harmony and nutrient absorption. By weaving together these strategies, nourishing foods, fasting practices, anti-inflammatory nutrients, Hydration and lifestyle adjustments, you align oral care with gut healing. The bacteria in your mouth and gut are not isolated, they are part of a continuous ecosystem that determines your digestion, immunity, and long-term health. Supporting them simultaneously ensures that harmful bacteria lose their grip, beneficial microbes thrive, and the cycle of inflammation is broken. This holistic approach is how true microbiome repair happens, not by focusing on one end of the digestive system, but by strengthening the entire oral gut axis from start to finish. The health of your mouth is far more than white teeth or fresh breath. It is the foundation of your gut health and the strength of your immune system. The oral-gut immune connection is a continuous feedback loop where the bacteria in your mouth influence the microbes in your gut, which in turn shape how 70% of your immune system operates. When the oral microbiome is balanced, the gut receives beneficial signals that strengthen its barrier, promote microbial diversity, and lower inflammation. This creates a body that resists infection, absorbs nutrients efficiently, and maintains energy. When oral balance is lost, however, harmful bacteria spread downstream, disrupt digestion, and fuel chronic immune activation. Understanding this oral gut health connection is the key to reclaiming long-term wellness. The journey begins with oral bacteria traveling through saliva and food into the digestive tract. A healthy oral microbiome seeds the gut with protective species and metabolites that keep harmful organisms in check. These beneficial bacteria help regulate pH, support enzymatic activity, and contribute to the production of short-chain fatty acids, which feed gut lining cells and strengthen the intestinal barrier. This is how oral microbiome immunity support starts, by reinforcing the gut's frontline defenses. A strong gut barrier prevents toxins and pathogens from entering the bloodstream, keeping systemic inflammation low. When harmful oral bacteria dominate, as seen with gum disease or chronic inflammation of the gums, the effect is entirely different. Pathogens like Porphyromonas gingivalis produce endotoxins that damage the gut lining, reduce microbial diversity, and promote leaky gut. Undigested food particles and toxins slip into circulation, activating immune cells constantly. Instead of a calm or regulated defense system, the immune network becomes hyperactive, attacking not only invaders but sometimes the body's own tissues. This explains the link between oral microbiome, chronic disease prevention, and long-term oral care. Neglecting oral balance fuels autoimmune conditions, cardiovascular problems, and metabolic dysfunction. By restoring the oral microbiome, you create a ripple effect that stabilizes the entire system. Balanced oral bacteria send fewer inflammatory signals, allowing the gut microbiome to reset. Inflammation decreases, nutrient absorption improves, and immune cells learn to respond appropriately. People often notice improved digestion, clearer skin, sharper focus, and greater resilience against infections when they address oral health. These are not isolated improvements. They reflect the deeper shift in the oral gut health connection. Practical steps make this transformation possible. Using mineral-rich toothpaste supports enamel without destroying microbial diversity. Oil pulling reduces harmful bacteria while preserving beneficial strains. Tongue scraping lowers the bacterial load and prevents pathogens from reaching the gut. Avoiding harsh antibacterial mouthwashes preserves microbial balance instead of wiping it out. When combined with gut-supportive strategies like prebiotic foods, probiotic ferments, fasting, and anti-inflammatory nutrients, these habits create synergy that restores harmony along the entire digestive tract. The result is not just healthier teeth and gums, but a stronger gut barrier and more efficient immune regulation. The science continues to show that oral microbiome immunity influences everything from metabolic balance to chronic disease risk. Gum disease is strongly linked with conditions like type 2 diabetes, rheumatoid arthritis, and heart disease. The common thread is inflammation. When the oral microbiome tips into imbalance, the cascade of inflammatory signals affects every organ system. The reverse is also true. When oral balance is restored, the systemic burden of inflammation decreases, lowering the risk of these diseases. Oral microbiome chronic disease prevention is therefore not an abstract idea. It is a practical reality backed by research and lived experience. The big picture is clear. Oral health is whole body health. The microbes in your mouth are not passengers. They are active participants in digestion, immunity, and disease prevention. By taking care of your oral microbiome, you empower your gut, calm inflammation, and unlock the full potential of your immune system. Every daily choice, from brushing with the right toothpaste to eating fiber-rich foods, becomes a vote for long-term resilience. When you align oral and gut health, You do more than prevent disease. You create the conditions for vibrant energy, mental clarity, and lifelong wellness. The empowering truth is that fixing your oral microbiome is not just about your smile, it is about protecting your body from the inside out.